I do want to kind of talk a little bit about where this is going. So that's kind of the end of our spiel of what we've been working on for the past 3+ years at Dartmouth. But what's really cool about tissue engineering is it's kind of broadened out from just looking at medicine. Okay, so I have given you a lot of examples of using tissue engineering specifically for, treating different types of diseases and injuries. But tissue engineering has also expanded to using engineered meat. So trying to find alternatives, for instance, to help with the environmental changes that we're having, right? So to think of ways to engineer meat and provide alternatives for that as well. Also engineering leather, so trying to reduce the use of real leather. And I already mentioned other types of tissue healing things. So organ on a chip is one of those as well, which I'm happy to talk about more. But there's just a lot of really cool opportunities within tissue engineering that has expanded from this initial focus of just healing different types of wounds. And this is slightly cut off, but we can see this whole graph. What you can see too is at the kind of the beginning of tissue engineering versus over the years. There's been so many publications and companies that have started to do this, which is really amazing. So tissue engineering is a little bit tricky, right? It's a new field. It's different than just an implant or something like that. So it took the FDA a little bit of a while to figure out how to process new types of tissue engineering devices and things. But since this has happened, there are over 20 to 30 companies that are currently using tissue engineering in the market for clinical use. A lot of them do focus on infection reduction and things like that. So for instance, I have a colleague who has a device that he uses in the gum. And so after you have a tooth pulled to prevent and help that healing, but prevent infection, because your mouth is really high risk of infection because you're eating and drinking and talking and things like that. So tissue engineering is already being used in clinics, which is very, very cool as well. And I'm happy to talk about that some more too.